InterSystems Iris for Health can easily integrate with devices such as EKG devices, oximeters, Fitbits, and many others. This integration opens doors to new ways of using patient data and ultimately improvements in patient care. Physicians are better equipped to address their patients' concerns when they have access to data when they need it. Iris for Health consumes data from devices, shares it with other appropriate applications, and can even store it in a central location so it can be analyzed. This means that by incorporating device data, a patient's current needs can be addressed and preventative care implemented. Let's take Nani, a newborn at General Hospital, as an example. Clinicians at General Hospital use an oximeter to screen all newborn infants for congenital heart defects, which are often treatable if detected early. Nani's clinician uses an oximeter to measure the amount of oxygen in her blood just after she is born. If oxygen saturation is less than or equal to 89%, there is a higher chance that Nani has a congenital heart defect and she should be treated. If the oxygen saturation is between 90% and 94%, this indicates a moderate chance that she has a defect. And by current hospital policy, a clinician would do a follow-up check after 24 hours. And if the oxygen saturation is 95% or greater, she passes the screening. Since General Hospital uses Bluetooth-enabled oximeters, this data is then automatically sent to a smart device app, making it easier for the clinician to gain insight from the data. While this instantaneous tracking is helpful, allowing the clinician to identify results immediately in the screening, there is so much more that providers can do with this data. General Hospital has recently started to use InterSystems Iris for Health to improve care in two ways. First, the device data is stored and analyzed to be used later to influence care improvements. And second, additional orchestration is implemented to decrease the number of false positives. This is done by identifying patients that are a moderate risk, and then sending a message to a scheduling application to automate subsequent screenings to verify whether treatment is necessary. Behind the scenes, the app connected to the oximeter sends FHIR data to InterSystems Iris for Health, which in turn analyzes and routes the data to the appropriate places. The EMR to incorporate data into the patient's full or future medical record, the scheduling app if a follow-up screening is needed, and an internal repository that is used for further analysis. InterSystems Iris for Health includes several beneficial features in situations such as these where you'd like to incorporate device data to both improve care for patients such as Nani and make the clinician's job easier. The first great feature of InterSystems Iris for Health is a built-in routing and data transformation engine that consumes the data and sends the appropriate pieces of data to the right places. At General Hospital, FHIR data is transformed to HL7 and routed to the EMR to be incorporated into the patient's full medical record. To interoperate with other health applications such as an EMR, InterSystems Iris for Health includes built-in transformations that make it easy to transform data into common formats such as HL7, CDA, or IHE, depending on what the application can consume. However, as we'll see with the scheduling app, data can also be completely customized and sent in any format, no matter how unconventional, allowing for full interoperability of data. Recall that in addition to routing to the EMR and scheduling application, data is also routed to an internal repository for further analysis. This leads us to the second feature of InterSystems Iris for Health. InterSystems Iris for Health includes many built-in tools for analysis, such as machine learning tools, a natural language processing engine for analyzing unstructured text, connectors to incorporate AI, and the ability to create embedded dashboards. The last key feature of InterSystems Iris for Health that we'll cover here is a low-code rules engine that provides an interface to easily define and update criteria for routing. This engine can be used in conjunction with the insights gained from the machine learning model to update rules based on the data. At General Hospital, this rule engine is used to check if the oxygen saturation score is between 90 and 94%, and if so, to send a message to the scheduling application to schedule a follow-up screening, making it easier for clinicians to track the journey of each patient. Nani's oxygen saturation falls in this range. Instead of being subjected to treatment right away, a follow-up screening is scheduled for 24 hours after birth. This gives both mom and the clinician peace of mind that the situation is being monitored and taken seriously, but without a rush into further and potentially unnecessary treatment. This means the clinicians can really focus on the patient and worry less about the paperwork or statistics. Clinicians can simply focus on how to best help patients such as Nani. For Nani, the follow-up screening came back stating her oxygen saturation was much higher, and therefore she did not have to undergo unnecessary treatment. However, if she had a different result, she would have had the help she needed. With InterSystems Iris for Health, General Hospital can make sure to identify issues early and give patients such as Nani the treatment they need. InterSystems Iris for Health improves care by accurately routing data to appropriate places such as the EMR and the scheduling app, and it sets up the infrastructure to continue improving care over time through analytics.